on this technology that you guys decided to start carrying?
Well, we're always looking out for different instruments that would benefit our patients, and our Patterson's rep said, come take a look at this because there's a lot of features that kind of take into what I want to, how I practice conservatively, and how to make it easier and better for my patients.
And so, I mean, that's what, when I was first told about it, that's the way it was framed to me was, this is all about making things easier on people, who come to the dentist.
Yeah, exactly. One of the benefits of this device is it catches cavities early. Obviously, one of our goals is to catch cavities before they actually happen, and if we get caught early enough, we can prescribe fluoride or have them brush better. But if we can find cavities starting at an early stage, we can actually take care of that cavity with a filling and use and if it does need a handpiece, sometimes we can do it without anesthetic. So a lot of our patients love it that they get to leave here without having to get numbed up and have that big fat lip feeling, so they can go back to work and not have a big the numb go back to work, or else they go eat lunch. And that's one of the benefits of this thing, so we can practice conservatively without the injection.
And it's called the Spectra, right?
Yes.
How's that spelled?
Spectra.
Okay. Does that stand for anything?
No.
Okay.
I'm not really sure how it came out.
Can you explain how the technology works for me?
Sure. The Spectra is like a camera that it projects a blue light onto the tooth, and what happens is the bacteria in the cavity absorbs that light and reflects it back. So what we get is like a Doppler radar image, kind of like you see on your guys' weather forecast. So we get blues, reds, greens, and those colors indicate if there is a cavity or not. So red means there is a cavity, blue is there's no cavity, and the good thing about the Spectra device is not only does it say yes there is a cavity or no there isn't a cavity, it tells us a numerical number like 1.5 or 2.0, so we know actually the depth of it too. So it goes back to what I just said about we know the depth of the cavity. So if I know if it reads 1.6, I can take care of it without having to numb up that patient. If I'm getting a reading over 2, that means I have to use anesthetic because it's a little deeper than what's required for anesthetic.
And you already said your patients just love the possibility of not having.
Yeah, they love the possibility of not getting a filling without anesthetic. Plus, I think they also enjoy being educated because a lot of us are visual learners. So when I put it on the picture on the monitor, they can kind of see what the tooth looks like, and they kind of see, oh yeah, that is a cavity there, and I need to get it fixed. Or if there's not a cavity there, and there is, other areas that they need to improve, they see where they need to brush better, or where they can, help to prevent a cavity from forming on the tooth.
And if you didn't have technology like this that gave you an exact measurement as to how deep the cavity is that something where you would basically just automatically use anesthesia just in case? Or does that kind of come into like your...
Typically we would use anesthetic if we feel, well, we use the old and tried technique of detecting cavities is using an Explorer, and we touch the tooth and we determine if it's hard or soft. If the Explorer sinks into the tooth, then it's considered soft. So by that time, it does require anesthetic. But the other good thing about using the Spectra is we can sometimes detect cavities that are not evident on X-rays. And if we, once we see a cavity on the X-ray, it gets fairly deep. So those are pretty much all 100% require anesthetic.
And so this is definitely a way of catching it earlier than, you saw on the X-ray. By the time it's picked up there, it's pretty deep.
Yes.
So this just kind of catches it much earlier. So it's almost almost preventative?
Yeah, it's a preventive type thing, and we do catch it earlier. So, again, when I was looking at new devices to put into my practice, and I practice pretty conservatively, this fits right into that because I can catch things earlier and have fillings that are less deep and not as big, and I can conserve tooth structure. And it just, the smaller the filling, the longer it's going to last.
Is there anything I'm missing that you would like to touch on?
Well, mainly it's just for the benefits of you know, your viewers and, you know, my patients. Just the fact that they can get fillings done, you know, without an injection. You know, sometimes we do still have to use the handpiece, but if we catch things early enough, and especially with kids, you know, kids, they do really good in the chair, but if we can do it without having to inject them with anesthetic, again, they don't have to worry about that injection. They don't have to worry about having a big fat lip feeling that they'll bite on for 2 months. And plus, it's less chair side for the patient, adult or children. So it's, you know, they're in and out pretty quickly that way too. So that's the main thing that you know, patients can get out of it.
And actually, let's touch on with the kids really quickly on that one. You know, a lot of kids are scared of the dentist. The society has kind of drained it into people's heads that the dentist is a scary place to be. You know, most kids just aren't exactly thrilled to come to the dentist. How does this help, you know, parents with their kids when they're coming in?
Well, a lot of them are wary of the pokey thing that they call it the pokey thing, or something that they explore, that we, you know, count their teeth and detect for cavities. So having a non-intrusive camera stuck in their mouth and taking pictures, they respond to it a lot better. It's easier for them too. And then if we do find a cavity, we can oftentimes take care of it that same day, so that the parent doesn't have to come back, because it only takes 5-10 minutes sometimes to fix a tooth, since we don't have to use anesthetic.
Anything else?
I don't think so.
I think we've